Hi everybody, it's Dr. Daniel, physical therapist here again to talk to you today about how to decrease shoulder pain. Whether you've had an injury or you reached and grabbed something wrong, you have shoulder pain, this video is for you. I'm going to show you some different exercises, different stretches, strengthening exercises, along with some different tips to tell you how to decrease your shoulder pain. I've used these exercises and tips on hundreds of patients with shoulder pain and shoulder injuries and help them get better, and I want to help you get better also, so hopefully this video is very helpful for you. Let's get started. First off, before we start talking about what to do, I want to talk to you about anatomy. So what makes up the shoulder? What bones and muscles make up the shoulder joint? We call it the shoulder girdle. So let's talk about bones. Two primary bones. You have your humerus, your arm bone here. You have your scapula, your shoulder blade in the back. Your scapula comes up and comes around, and it's this top bone here. This is called the acromion. The ball of the humerus sits on the glenoid fossa, which is part of the scapula. It sits on the glenoid fossa, kind of like a golf ball sits on a tee. It can come off very easily. So there's not a lot of stability, bony stability with the shoulder. So talking about muscles and tendons. So we have our rotator cuff, not cup, C-U-P, but cuff, C-U-F-F. It's made of 4 specific muscles and tendons that attach to the shoulder blade, the scapula, come around and hug the ball of the humerus, pulls it in and keeps it stable. So talking about the rotator cuff, 4 different muscles and tendons. The one in the front attaches to the front side of the scapula, so in between the scapula and the shoulder blade. It comes around, comes in the front, the subscapularis. It attaches on the tendon, it attaches on the ball of the humerus right here. The next one is the supraspinatus. It's underneath of your upper trapezius muscle here. It attaches to the top of the scapula here, it comes around underneath of this bone here, the acromion, and then attaches right here on the ball of the humerus. 2 on the back. They both attach to the back of the scapula, come around. Top one is the infraspinatus, bottom one is the teres minor. So those 4 muscles and tendons keep the ball of the humerus where it needs to be. One other one that does help out a little bit too is the long head of the biceps. The biceps it attaches down here, comes up and separates into 2. One that attaches to the coracoid process, which is a little bony prominence off of the scapula, and then the other one comes up into the joint capsule and attaches to the top of the glenoid fossa, the bone we were talking about, where the golf ball sits on the tee. So that's the tee, and that's where the long-headed bicep sits. So it gives a little extra stability to the shoulder too. So those are the bones and the muscles of the shoulder, which we have to talk about before we get into the tips, stretches, and strengthening. So hopefully that little bit of anatomy helps you understand what's going on with the shoulder if you have an injury. We're going to talk about 3 things: biomechanics, stretches, and strengthening exercises. So let's get right into biomechanics. So biomechanics is how the body moves, how we're moving around, the mechanics of the body. So positions to not let your shoulder get into if you're having shoulder pain. That's going to make it worse. Obviously, if you get into that position, pain's going to tell you not to go there, and you want to stay out of the pain range if you're having shoulder problems, shoulder pain. Pain is there for a reason. It's telling you to stay away. So 1, reaching up. A lot of times when people are having shoulder pain, reaching up causes a lot of pain, and we'll get into why here in a little bit. So that's 1, especially repetitive reaching up. Reaching up to grab something out of the cupboard, a can or something. Just stay away from that. Try to use your other arm for right now until you can get to the pain down and get it feeling better. Number 2, position to stay out of. If you're sitting in a car, or if you're sitting in a lazy boy or something like that, reaching back like this. So if you're sitting in the car in the front seat, reaching back to get a heavy purse or something and pull it up into the front seat, or whatever it is in the back seat, pull it in the front seat. That puts the shoulder in a very compromised position where it can cause shoulder pain, increase your shoulder pain, or really hurt the rotator cuff, because it puts the rotator cuff in a stretched position and it's not good for us. So stay away from that. Same thing sitting in a lazy boy chair. If you have to reach sideways, sometimes that can be you get to be careful with that, and back. It's better to turn your body if you can a little bit and reach more in a forward position compared to a side position. So those main two positions, reaching back and reaching up, those we want to stay away from if you're having shoulder pain. Positions that actually feel good if you're having shoulder pain. How to help position-wise decrease shoulder pain. So if you're sitting in a chair, one good thing to do is have a pillow underneath your arm. So not only here, but have the pillow kind of at an angle where it's here. Your arm in this position is has the least stress on the shoulder here. Here it's a little more stress on it. Here it's very relaxed. So you want to have a pillow here, either whether you're seated or whether you're laying down. So let's talk about sleeping. So if you're sleeping and you have shoulder pain, a great position to be in is if you're on your back, have the pillow on the bed here, have it coming across here, so your elbow is rested on the pillow, your arm is rested on the pillow here. So you're in this position when you're sleeping compared to here. It's going to be a little bit more of a comfortable position. If you're on your side, if you're a side sleeper, of course sleep on the opposite side. So if this is my painful side, same thing, pillow here, pillow right here, here, here if I'm on my side sleeping. Very comfortable position to be in. Alright, so that's number one, biomechanics. Number two, stretches. So a couple different stretches that we're going to do. We're going to stretch the front, then we're going to stretch the back here too. A lot of times the pec major can get tight when you're having shoulder pain. Everything kind of tightens up when you have shoulder pain in general. So we're going to stretch the pec major. So a lot of different ways to stretch your pec major. The most comfortable position is laying down on your bed and just letting your arms fall to the side. That stretches your pec major just a little bit. If you want to get a stronger stretch, what you need to do, get in a doorway. You can use both arms on the door frame and then have your feet straddled one in front of the other. Lean forward slightly until you feel that stretch right across your chest here. What you don't want your arm up really high. That's going to probably be very uncomfortable for you. You want your arm below the horizon, below horizontal. That's going to be very comfortable. You can do it with just one arm, just the side you're having problems with is fine. You can have your whole arm against the door frame, or you can just have your hand against the door frame like this and you're pushing forward like this on both sides, or just one side, either way. Anytime we're stretching, always give the recommendation, hold it 10-15 seconds to start with, see how that feels, go up to about 30 seconds. Do that 2 or 3 times, reps, and then 2 or 3 times a day. So doorway stretch, number one. Number two is going to be arm across the chest, which is going to stretch the back muscles and the back tendons here. So very simple. Grab onto your elbow, come across just like this. So I feel a little stretch right in here. You don't want to come up too high. You want to stay a little bit lower. You find that position where it feels good for you or it's comfortable for you. Come across just like this until you feel that comfortable stretch back here. You can even rest your arm up here on your other shoulder if you'd like to, just so it's completely relaxed. Same time frame, hold time, 10-15 seconds, up to 30 seconds, 2 to 3 times, and then 2 to 3 times a day. So those are the only 2 stretches I'm going to show you. Next we're going to move into strengthening, which is the most important part. So these strengthening exercises I'm going to show you next are really the most beneficial thing you can do to decrease shoulder pain. So we'll get into that. Number 3, strengthening exercises. These are very important to help decrease your shoulder pain. You have to be doing these strengthening exercises to help decrease the pain that you're having. So what are we strengthening? We're going to be strengthening primarily the rotator cuff muscles and tendons. So the rotator cuff, like we talked about in the anatomy, hugs the ball of the humerus right on top of the glenoid fossa, kind of like we talked about the golf ball on the tee. It would fall off very easily if it wasn't for the rotator cuff muscles and tendons. So we got the one in the front, the one on the top, and the 2 on the back. So we're going to strengthen them using 2 different muscles and using a TheraBand. So you're going to have to buy a TheraBand for these exercises. You can get them on Amazon. You can get them probably even at Walmart, Target. I've even seen them at CVS, Walgreens, drugstores, things like that. And usually they come in a package where there's different multiple colors. So the colors usually go, with most companies, yellow, red, green, blue, black. Yellow being the easiest, black being the hardest. Different companies have a little bit different colors. This is a yellow one here. And so you always want to start with the easiest, the least resistance band first, and then you can build up from that. So we're going to strengthen the rotator cuff muscles. So what you want to do once you have the band is you need to tie it to something. So there's a lot of different ways to do that. The easiest way to do that, if you're at your house and you have a doorknob that you can wrap it around, what you want to do is you want to put a loop in it. Put a couple knots right here, put a loop in it, put that around the doorknob on one side, close the door with this coming on the other side of the door, and this is what you're going to use to strengthen. So this is around the doorknob on the other side of the door with the door closed and latched. So that's one way. If your doorknob doesn't work right, you don't have a good doorknob that you can put it on, what you can do is you can just put a couple knots at the very end down here, just tie a couple knots into it where it's a good bulk right here. Put that in the other, kind of toss it up on the other side of the door, close the door with it on the other side of the door. As long as the door is latched, it shouldn't come out. So that's another way to do it. Or the third way to do it, which is what I'm going to do, is tie it to a post. I don't have a post, so I'm going to use a tree, because that's what I have available. So, but if you're in your house, the best thing to do is in your house is the door is the best way to do it. Alright, so we're going to do internal and external rotation. So those are the two most important exercises that you can be doing to decrease your shoulder pain and help strengthen your rotator cuff muscles. So internal rotation, external rotation, what are they? Internal rotation is coming in, external rotation is coming out. So those are the exact same motions we're going to do to do the strengthening exercises. So internal rotation. Got it tied to the tree? At home, you can do the door like we talked about, coming in. So you're starting here. So you want to start with your arm and straight out in front of you, this direction. You don't want to start way out here. Let's put a lot of stress on the shoulder. So start here, pulling in. One thing you want to do is you want to maintain a space between your arm and your body. So a good way to do that, to maintain this space when you're pulling in, is grab a towel from your kitchen. Just a hand towel, roll it up, fold it up, put it right here, let your arm rest on it, and that creates that space when you're pulling in and you're pulling out. So that's a great thing to use. Internal rotation, you want to start off with maybe 10 reps, see how that feels. Start off with the lightest band that you have, the yellow, whatever color is the lightest that you buy. 10 reps, if that's okay, go to 15. If that's okay, go to 20. Try that twice a day, see how that feels. So just like that. External rotation. We're going to just turn around. We're going to do the opposite motion. So you got it into the door. So all you're going to do is turn around. So external rotation is that exact opposite motion. You still have the towel here. You're starting at your belly. You're pulling out. Just like that. If you can see that. Pulling out. What you don't want to do is you don't want to extend your arm. You don't want to straighten your elbow. We're working the triceps when you do that, and that's not the muscle we're primarily focusing on. We're focusing on the back of the rotator cuff. So we're focusing on the teres minor, teres infraspinatus, and teres minor, along with the back half of the supraspinatus. When we're doing internal rotation, by the way, we're working the subscapularis, the one in the front, and the front half of the supraspinatus. So, talked about not extending the elbow. You want to have your elbow at a 90-degree angle the entire time you do this exercise. Start at your belly, come out to where it's directly out in front of you. You don't want to go out real far because it puts more stress on your shoulder. So just like this. Simple, easy, nice and slow. You don't want to go fast with these exercises. Nice slow pace. Same amount of reps, 10, 15, 20, a couple times a day. This one's going to be harder. You'll feel it. It's going to work your shoulder muscles more, but it's very important. So why are we strengthening the rotator cuff muscle so much? That's where you have the stability of the shoulder. So like we talked about, it's a golf ball and a tee. It's going to fall off really easy. unless we have something to hold it in place. So that's what the rotator cuff muscles do, that holds it in place. That's why it's so important to strengthen the rotator cuff muscles. So that's number 1 and number 2 for the strengthening exercises, internal and external rotation. All right, number 3, third exercise we're going to work on to strengthen the muscles around your shoulder girdle and help decrease pain. So we're going to talk a little bit about posture with this too. So what happens with a forward head and rounded shoulders posture is it puts a lot of compromise, puts your shoulder in a compromised position when you're reaching up and grabbing things. So if I was having bad posture, I was in this position, I try to reach up and grab something. I don't know if you can see this, but that's about as high as I can go because the bones stop me here. But if I get up, stand up straight, I can go up all the way. So keeping your shoulders in this position allows you to reach up and do things easier with less pain, be able to reach up higher. So we're going to strengthen the muscles between our shoulder blades to help us keep us in this position with our shoulders back and having good posture. So we're strengthening primarily the rhomboid muscles, which are right between your shoulder blades here. So what you want to do is you want to put your band around a post in your house, or you can put it, let me show you, you can put a knot, tie a couple knots just like this, where it's a nice big bulkiness, so you have two ends of it. Throw this on top of your door. Once it's on top of the door, on the other side, close the door. When it's on the other side of the door is closed and latch, then you can pull, it's going to catch that knot on the other side, and then you can pull both sides down, and then you can do this exercise like that. So that's really the best way to do it. You can, like we talked about, put it on the doorknob on the other side of the door, close the door, and then you got two bands here with the it latched around the door knob on the other side of the door. So for me, I'm just going to use a tree. So talk about bringing your shoulder blades together. So that's what we're going to be doing with this exercise. Just like this. Don't come up. Don't come up. We're strengthening the upper trap with doing that. We don't want to be strengthening that. We want to be strengthening the muscles between the shoulder blades and even the ones a little bit lower, a little bit of your lats also, latissimus dorsi muscles. Just like this. 10, 15, 20 reps. This one shouldn't be too bad for you if you're having shoulder pain. 2 to 3 times a day. And then another one you can be doing is just throughout the day, just be squeezing your shoulder blades together. Let it relax. Squeeze together. That's also going to help strengthen those muscles there too. So that's strengthening exercises. Exercise number 3, we call it the rows. So you're rowing. All right. So that concludes how to decrease shoulder pain. So we went over biomechanics, we went over stretches, and we went over strengthening exercises. It's a pretty simple program, but if you stick to it, if you do this 4 to 5 times a week, twice a day with the stretches and the strengthening exercises, it will, over time, help decrease your shoulder pain. But you have to give it time. You have to be patient and give it a couple weeks. Usually with patients I've treated, it takes at least a couple weeks for them to start noticing that they're having a little bit of progress because their pain is decreasing and they're able to reach up a little bit higher with their functional activities. Give it 3 to 4 weeks for it to really have a good full effect. But I really do hope it helps you out. I hope it decreases your shoulder pain. I hope it gets you back to functioning, reaching, doing things without having the problems that you've been having. That concludes the video. If you like this video, please hit the like button below. Please comment if you have any questions. I'll do my best to answer any questions that you have. If you'd like to see more videos, just please let me know which videos you'd like to see, what body parts, what things about physical therapy you'd like to see, and I'll be happy to make a video on those specific ideas. If you'd like to see more videos, I'll be making more videos like these. Please subscribe to my channel, and you'll be able to get those videos quickly to hopefully help decrease pain in your life get you back to function and get you back to having an amazing life. All right, hope you enjoyed. Take care.